A presentation by NMS.
A stakeholders meeting on immunization in Kampala has revealed that as much as the country has made great strides in national immunization coverage, from 88% last year to 98% this year, a number of districts are still underperforming. Districts like Wachiso, Mbarara, Rukunjiri, Ntungamo, Kabare, Nakasongola, Kumi, and Moyo fall in the underperforming category, despite the availability of free vaccines and available facilities. The State Minister for Primary Health Care, Sarah Opendi, told NTV that government noticed a growing trend in certain areas where parents refuse to have their children immunized.
People want government to take services into their homes, which is very unfortunate.
The ministry now plans to introduce a law to have such parents penalized.
As soon as we convene, this bill will be presented so that it can be passed into law, so that parents who do not take their children for immunization can actually be penalized.
There are also reports that some health facilities are selling vaccines that government says are supposed to be provided free of charge.
I also want to appeal to the private not-for-profit hospitals, those other private health facilities, that we give you this vaccine free and we expect you to give it free.
The ministry, through the Global Alliance for Vaccines initiative, intends to roll out new vaccines early next year, as well as stop the use of others.
Meningitis vaccine, but targeting 38 high-risk districts. We will also introduce the rotavirus vaccine, the vaccine against diarrhea amongst the children, and of course also remove the oral polio vaccine and introduce the injectable polio vaccine.
In 2002, the Ministry and World Health Organization increased the number of immunizable killer diseases in Uganda from 6 to 8 to be given before the baby is a year old. These are measles, polio, tuberculosis, whooping cough, tetanus, hepatitis B, influenza B, and diphtheria. Uganda spends over 38 billion shillings on immunization every year. This year alone, the Global Alliance for Vaccines initiative injected 6 billion shillings into immunization, with 4 billion of that going to the introduction of the human papilloma virus to immunize girls who are 10 years old against cervical cancer.
We are here today to discuss more on how we can strengthen especially the accountability from the district.
Uganda over the past few years made commendable strides to reduce under 5 mortality rates by rolling out nationwide immunization campaigns. Gertrude Tumusime with Kware, NTV.